and welcome to the National Briefing. At this point, let me invite the Chairman of the PTF to come up to the podium for his remarks, after which we shall take the technical updates from the Minister of Health, the DG and CDC, and the National Coordinator, in that order. The Chairman, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 27th July 2020. But let me also particularly welcome Dr. Walter Kasadi Mulumbo, the WHO rep in Nigeria, who is attending this press briefing for the very first time. You are welcome, sir. Thank you so much for coming, and thank you for all the efforts and support we've been receiving from the WHO. That's Fiona's colleague here in Nigeria. You will recall that we briefed the nation on the 29th June 2020 sequel to the approval of the President for the extension of phase 2 of the eased lockdown for another 4 weeks. That extension is due to expire on Wednesday, 29 July 2020, having commenced on the 30th of June 2020. The Presidential Task Force has continued to evaluate the developments as well as the level of compliance nationwide, and has regrettably come to the inevitable conclusion that majority of Nigerians, irrespective of status, creed, and level of education, continue to live in denial on the virulent nature of the virus and consistently breach the guidelines and non-pharmaceutical measures put in place. We informed you 2 weeks ago that the process of submitting the 6th interim report and recommendations for next steps had commenced. The Presidential Task Force has reached advanced stages of the process. It has also considered that due to the upcoming Salah, Eid al-Kabir festivities, which coincides with the expiration of the current phase, it will be prudent to extend by 1 week from 29th July till Thursday, 6th August 2020. It has accordingly secured permission to retain the existing guidelines till that date. Considering the importance of international air travel to the economy, the Presidential Task Force and the aviation sector are working hard to fast-track reopening of the international airspace. Most importantly, the arrival protocols for passengers on inbound flights are being firmed up for seamless testing and detection. Relevant MDAs will be holding further consultations. The COVID-19 remains very virulent and very dangerous. Current statistics show the following. Global cases recorded now stands at 16,380,397 cases from 215 countries and territories. Global deaths stand at 651,198, while global recoveries stand at about 10 million recoveries. On the continent of Africa, cases are, as of today, 848,771 cases. Death toll, 17,791, and about 500,000 recoveries. In Nigeria, cases as of today stand at 40,532 cases, with fatalities of 858, while about 17,000 recoveries. The WHO statistics show that on the 24th July 2020, the world recorded 284,000 plus confirmed cases and 9,750 deaths. Both were records in terms of the spike in the daily numbers, and they represent a red flag to all nations. That in spite of almost 6 months of tackling COVID-19, an investment in billions or trillions of dollars, we still recorded the highest number on the 24th of July. And that's a clear picture of what is confronting the entirety of humanity. Our analysis has shown that people over 50 years of age, especially those with underlying factors, remain most at risk. This position is backed by the fact that 65% of fatalities recorded in Nigeria are in this category. So if you take the figure of 558 fatalities in Nigeria, 65% of these fatalities fall between the age bracket of 50 and above. That brings me to the need to appeal to Nigerians on the need for a change of behavior and compliance with measures put in place. If you do not need to go outside your home, please stay indoors. If you do not need to attend any occasion, avoid large gatherings and observe all the measures that have been introduced. In recent times, our risk communication teams have developed messages aimed at resonating very well with different demographic groups. The common string is the message for compliance and the proper wearing of face masks and coverings in public spaces. The national coordinator would elaborate further on this. Yesterday, being Sunday, I decided to just drive outside the city of Abuja for the second time again. And this time, instead of going to the Kuje area, I decided to go to the Karu, Nyanya, Jukoi, Aurozo area. And to my utter disappointment, people are just moving around as if there is nothing like COVID-19. I think that of Kuje was even better. I saw 3 people wearing masks, two wearing them inappropriately under their chin, with only one that had it properly worn. That of Karu, Jukoi, Orozo area, people were just on their own, doing whatever they wanted to do with themselves, in total disregard for the non-pharmaceutical measures that have been put in place. And we are at the stage of community transmission. I believe the national coordinator will be elaborating further on the need for strict adherence to this compliance, to these measures that have been put in place. As we prepare for the Eid al-Kabir celebration. We also want to urge all our Muslim brothers and sisters, and indeed all Nigerians, to continue to observe all measures. We note with delight the increasing number of states that have shelved activities during this Salah celebration, and we still urge others yet to do so to follow suit. The World Health Organization has also introduced self-Eid practices in the context of COVID-19, and I urge us all to access and disseminate this information. I believe the National Coordinator will further elaborate on this as he gives his update. Similarly, the Presidential Task Force appreciates the Nigeria Spring Council, who has always been a great champion in the fight against the pandemic, for advising Muslims to avoid massive gatherings at Eid grounds and pray at area mosques under prescribed protocols. Ladies and gentlemen, I'm pleased to inform you that the Presidential Task Force is making steady progress in bringing more states within the national network and reporting system. This will greatly enhance the outcome of COVID-19 national response and will be more beneficial to the citizens of those states and the country in general. I now invite the Honorable Minister of Health, the DG, Nigerian Center for Disease Control, and the National Coordinator to the PTF to present their updates, and thereafter we will have certain interventions by honorable ministers here. I thank you for listening.
Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19 Response, Secretary to the Government, honorable ministers, the permanent secretaries, the national coordinator, the DG, directors, and ladies and gentlemen here present. May I also join in welcoming our colleague, Dr. Walter Kazadi Mulongbo, who is our new WHO country representative to Nigeria and assumed duty about 2 weeks ago, and familiarizing himself still with this terrain. The total number of confirmed COVID-19 cases in Nigeria crossed the 40,000 mark to 40,534 over the weekend, with 555 new cases recorded in the past 24 hours, and on the whole, 17,374 persons have been successfully treated and discharged from hospital. We have regrettably lost a total of 858 persons, most of them with comorbidities. With 262,579 persons tested so far, we have crossed the 250,000 mark, and as you know, we are heading for the 2 million mark. When the epidemic curve will begin to flatten is still a matter of conjecture, given the relatively small fraction of our population that has so far been tested. It is our plan and our endeavor that our health system be not challenged beyond what it can bear. 60 PCR public health laboratories are now active in Nigeria, and together should be in a position to address the testing capacity challenges and ramp up utilization if the logistics are able to get proper improvement. This would, along with the sheer community spread, be responsible for the rising trajectory of the epidemic curve in the population so far tested. The 70 to 30 male to female gender ratio and the case fatality in our country of 21% have not changed significantly. But 2/3 of all fatalities remain in the over 50-year-old group, while comorbidities like diabetes, hypertension, asthma are common among all fatalities. They underscore the need, as we have always said, and I repeat again today, that we need to protect senior citizens and the vulnerable from infection by giving special attention to risk communication targeted at them. Again, I say we give priority for admission for observation and treatment so that complications can be easily detected and attended to before they blow into out of proportion. Of utmost concern are still our young asymptomatic cases with the potential to spread this disease while themselves being quite well, and of whom the young and able-bodied can be difficult to manage. We see that in other countries too, where there can be resistance to efforts to control this disease, working with the population. But it is clear that success in managing COVID-19 will depend on a very strong relationship between the governing and the governed, and the strong collaboration of citizens with laid down rules and recommendations. We continue to strive to improve the quality of service in our hospitals as more persons are admitted to treatment. But this time, not only for COVID-19 infection, but for routine and essential care. It is our desire to reduce fatality rates, as I've said, expand treatment capacities such that our health system cannot get overwhelmed. In this regard, the Federal Ministry of Health expects to take delivery of a newly completed isolation center at University of Abuja Teaching Hospital, Gwagwalada, very soon, just as other centers are under construction nationwide. So we're expanding our bed spaces and our capacity to admit in expectation, as we have always said, being able to prepare for the worst and strive for the best. The UN system in Nigeria has informed us of the arrival of another consignment of essential COVID-19 related commodities yesterday, to be officially handed over to us soon. We remain appreciative of the UN system for this gesture and their consistent support, which greatly increases our reserves and recognizes our needs, especially of oxygen concentrators and personal protective equipment, but also reassures our frontline health workers that we are well stocked and can ensure availability of essential items and consumables at point of use. I also use the opportunity to salute our frontline health workers whose service helps to reduce fatality and urge them to continue their work in line with global best practices in case management and to keep themselves safe and take no risks in the course of rendering service. Coronavirus does not respect doctors or nurses. As this holiday period approaches, I want to wish again our Muslim brethren happy celebration and enjoin all persons not to forget the prescribed precautions and to reduce the risks of transmission, even as we celebrate. Very simple. Wear your mask at all times, especially when out of your home wash your hands regularly, use sanitizers, practice distancing. I remind everyone that controlling the spread of COVID-19 is not the responsibility of government alone, but of all of us individually and collectively. No one should think that they are immune to this dangerous infection, and everyone should bear in mind that they are their neighbor's keeper, and their neighbor will also protect them. Thank you for your attention.
Chair of the Presidential Task Force and Secretary to the Government of the Federation, Honorable Ministers, Honorable Minister for Transport, WR, thank you very much, gentlemen of the press. And my comments today will be very brief. I think the issues have been flogged very hard. We crossed a number of very important milestones last week. 16 million cases worldwide. 16 million cases worldwide. 640 deaths. 40,000 cases in Nigeria. Just under 1,000 deaths. So anyone that is still not taking this disease seriously can only have himself or herself to blame. But really, I just wanted to share a few words around risk perception. And the more common something is, the tendency is that we take it a little bit more lightly. And just like the Secretary to the Government of the Federation mentioned today, it's increasingly alarming, the rate and the high-risk behaviors that we continue to carry out across the country. Yes, Mr. President agreed to ease some of the lockdown measures, not because we wanted to, but because we had to. Because we had to stay alive. But to stay alive, we also have to do some basics. Wearing a mask might seem very cumbersome, but I promise you, it's less cumbersome than being on a ventilator. It's less cumbersome than being on a ventilator. Over the last few weeks, many of you would have heard stories of survivors. But there are many stories that could have been told that you have not heard. Stories of those that have passed away. Many of us have become desensitized about the messages because we say them so often, over and over again, for the past 6 months. Even for us coming out here every day to speak, sometimes it is a challenge, having to say the same things over and over again, asking all of us to take responsibility, to do the best that we can. So we continue to do that, recognizing the efforts of many frontline health workers across the country that are working every day. As we intensify our risk communication efforts and messages, try different techniques, use different media, try and say the same things using different means, different words, the message is still the same. We must do our best to protect each other. Nigeria is an incredibly large country. No one person can carry out this fight on our own. It really requires all of us to work together. So please, I urge all of us not to throw caution to the winds, to keep taking responsibility, and together we will win this fight eventually. Thank you very much.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be talking about the oncoming celebrations of Eid al-Adha or Eid al-Kabir. The PTF understands that Eid al-Kabir is a major celebration for Muslims globally. We would nevertheless want to remind us all that the safety guidelines for the second phase of the ease of lockdown is still in place for the purpose of public safety. In fact, the protocol we have designed with regards to places of worship remains effective, as at the time we opened the mosques and churches. For this reason, the PTF strongly advises against mass public gatherings in any form. Safety is important. Infection control measures must be observed in public spaces at all times. We urge states and religious bodies to make specific determination and recommendations regarding Eid congregation in their respective states. As mentioned by the chairman earlier on, we are aware of some states have already put out guidance, and for those that have restricted celebrations, we are grateful for the proactive step they have taken. It's important to note that coronavirus continues to be a significant threat to all of us and to our way of life. We know that it does not discriminate. We know that it doesn't really care whether or not you are celebrating Salah. We are all susceptible and we need to take care. In terms of the specifics, I'll first of all start with talking about the issue of physical distancing, which needs to be at least a meter between people at all times. We strongly recommend the mandatory use of face masks and urge authorities to make sure that those persons not wearing face masks are not allowed entry into the places of worship, especially during Salah. Strongly recommend avoiding physical contact. Greetings is a good thing, but you can greet each other by waving, by nodding, or by placing your hand over your heart. We will continue to prohibit large mass gatherings in public spaces, so durbas, street shows, and public gatherings. We strongly discourage social gatherings and family visits, especially by members, by friends that are not part of the family set up in the household, and particularly as it relates to vulnerable populations like those above the age of 60 and those with comorbidities. All entertainment venues shall remain closed during the Eid period. Our advice to high-risk groups remains that those above the age of 60 years or have comorbidities should preferably stay at home, and those sick and or having symptoms should not attend the Eid prayers. In terms of mitigation measures when it comes to physical gatherings, we recommend holding the event outdoors for the prayers, if possible, if the weather permits. If it has to be indoors, the numbers should be limited, and we must ensure adequate ventilation and airflow. All events should be shortened to limit potential exposure, because the longer you stay within an enclosed environment with an infectious person, the more likely you are to catch it. Total time, including sermons, remain unchanged as per our previous guideline and not to exceed an hour. We strongly recommend holding smaller services with fewer attendees or staggering the prayers, and particularly making use of neighborhood worship centers rather than large congregations. We advise maintaining physical distancing throughout, including during the period of prayer, during the performance of ablution, etc. Religious authorities are advised to regulate the number and flow of people entering, attending, and departing from worship areas and to ensure safe distancing at all times. We expect temperature monitoring as well as arrangements to deal with sick persons and the facilitation of contact tracing if this happens. From the point of view of maintaining a healthy hygiene, hand washing facilities must be adequately equipped with soap and water. We strongly advise on the use of alcohol-based hand rubs at entrances and inside places of worship, and the provision of disposable tissues, as well as bins with closed lids to enhance the safe disposal of waste. Where people are attending, preferably attend with your own personal prayer rug to place over carpets, with frequent cleaning of often touched surfaces such as doorknobs, railings, etc. In terms of animal management and marketplace restrictions, since this is Eid al-Adha, this is Eid al-Kabir, we'll all be slaughtering rams, we urge the allocation of enough space to keep animals and to avoid overcrowding in anticipation of slaughter. We encourage slaughter at facilities while practicing physical distancing, hand hygiene, and adequate protective measures. Preferably, if it has to be in a home, then preferably nominate a household member to perform this and to help with the distribution of food, of meat, so that we reduce exposure to other members of the family. We certainly discourage overcrowding associated with the distribution of meat and consider physical distancing measures in place. In summary, I would like to echo the statement by the Nigeria Supreme Council of Islamic Affairs released yesterday under the leadership of its President General and Sultan of Sokoto, His Eminence Alhaji Muhammadu Saad Abubakar, and I quote, "We are living in unusual times where normalcy has become abnormal, including social gatherings and large congregational prayers. Muslims are enjoined to note that Eid al-Adha is not a compulsory religious activity and should only be observed if security of health of our own lives and as well as our health is maintained. Muslims should continue to act according to the established protocol in their various communities and locations in Nigeria during the forthcoming Eid al-Adha. In places where restrictions have been lifted from congregational prayers, Muslims should observe their Eid prayers while still taking necessary safety measures regarding personal hygiene, facial masks, and social distancing. It is even advisable that in such places, massive gatherings at one Eid ground in a big city should be avoided. Rather, the Eid could be performed in area mosques to avoid unmanageable crowds. However, in places where the ban on public congregational prayers and social religious gatherings is still in force, Muslims are directed to be law-abiding while appreciating that intentions supersede actions and actions are judged on the basis of intentions." Close quote. We are grateful to the Nigeria Supreme Council of Islamic Affairs for continuing to support our actions against COVID. And we know that this is not yet over. It is not over yet until it is over. Let us try and stay safe and stay alive. Eid Mubarak. Thank you.
Thank you very much, National Coordinator. We will take further updates this evening. We also have with us the Honorable Minister of Transportation, Honorable Rotimi Amechi. You're welcome. He's attending this national briefing for the first time. And I'll be inviting him to the podium to speak about the railways. After the Honorable Minister of Transportation, the Minister of Environment will come to the podium to elaborate on a few things in vernacular. Honorable Minister of Transportation, sir.
The Chairman of the Presidential Task Force and members of the Presidential Task Force, my colleagues, distinguished ladies and gentlemen, If you see, I brought 2 items. If anybody has ever seen me in public without this, let the person raise his hand. In public without this. I carry this everywhere I go. The reason is I have seen people die of COVID. So I'm dead scared. If you ask the last speaker, I refuse to agree that we should open the railways. It is the pressure of those who want to participate in the forthcoming spiritual activities that made me accept that we'll open the railways from Abuja to Kaduna. What are your requirements? We don't want to see how handsome you are or how beautiful you are. Please wear for me a face mask. Not a mouth mask. Nigerians wear mouth mask. They wear like this. If you do that, the train will stop and you will come down. There is no Christian, there is no Muslim in death. I hope you know. When you die, you go and face your God. Exactly. And some of us are not ready to face our creators. So don't take us down there. So the moment you bring down your mask, the police, we have increased the number of policemen in each coach. The police will ask you to wear back your mask for respect. If you refuse, he would ask the driver to stop. Pray we don't stop at Regina. How many of you know Regina? No, that's where they carry people, you know. If it's at Regina, you will come down there. If they carry you, you will come back after the spiritual activity. We will allow this type of mask. We will also possibly allow, not possibly, we will allow the cloth mask made by Nigerians. But that's the mask that people put in their mouth. So when you're getting the locally made mask, it must be such that covers both nose and mouth. Don't come with face shield. If you want to come with your face shield, don't forget to come with your face mask. You will not enter the station if you don't have a face mask. You will not enter the station if you don't have a hand sanitizer. We must see a hand sanitizer. We must make sure it is not below 79% alcohol. This one is 100% alcohol, 100%. This is not show. This is methylated spirit and alcohol. But for those of you who can't, this is locally made. For those of you who can't bring alcohol and methylated spirit, come with your, sanitizer that is not below at least 79% alcohol. We will check it. I'm not joking. I will be there on Wednesday morning, and I will be there till mid-afternoon. We have reduced, for purpose of physical distancing, the number of passengers. Coaches that convey 88 passengers will now not convey more than 50 passengers. So you have your space. That's why we increase the transport fare from 1,500 to 3,000 for economy. For business class, 5,000. And for first class, 6,000. First class, you don't need social distancing. It's just 23 seats in a coach of 88. So you have enough space. But for economy and business class, you will need physical distancing or social distancing. And that's why we have created those spaces. I said mask. I didn't say wrapper. I didn't say cover your face with wrapper. We don't mind you covering your face with wrapper, but we must please show us your mask before you cover fully, before you step in. Inside this waiting room, we don't have enough seats. So if you don't have a seat, please wait outside. It will be one bench of 3 seats to 1 passenger, no longer 3 persons. That's what it will be. You may not be allowed to move freely inside the coaches, except you want to use the toilet. Apart from using the toilet, you will not be allowed free movement. We are bringing in as many policemen as possible, not only for security, but for enforcement. I don't know if I've forgotten anything. I think that's this thing. Give us between 2 and 3 months. Between 2 and 3 months, we will start electronic ticketing. That way, nobody will come to the station to buy tickets, and there will be no need for physical or social distancing. Thank you very much.
Thank you, Honorable Minister of Transportation. Before we take the Minister of Environment, I will bring podium the Minister of Aviation. Minister of Aviation, please.
Mr. Chairman, distinguished colleagues and gentlemen of the media, good afternoon to you all. Well, we have received tremendous amount of emails and WhatsApp messages and phone calls and so on and so forth that we should open up international flights. And of course, we've taken it for granted that people understood that it's not a function of aviation alone. Otherwise, there would not have been a task force. So this is a function of a lot of MDAs, function of government. But National Air Transport Facilitation Committee has been established, which comprises of the following membership: Ministry of Aviation, Foreign Affairs, Health, Ministry of Culture and Tourism, Nigeria Civil Aviation Authority, Federal Airports Authority of Nigeria, Nigeria Customs, Nigeria Immigration, Nigeria Police, Nigeria Agricultural Quarantine Service, Ministry of Interior, the State Security Services, Nigerian Drug Law Enforcement Agency, Nigerian Airspace Management Agency, the Ground Handlers Association, the Freight Forwarders Association, the Air Operators Certificate Representatives, Airline Operators of Nigeria Representatives, Nigerian Civil Aviation Security Committee, and the Airport Security Committee. They will be having their meeting tomorrow to further discuss the protocols as to open up the airports. Certainly, aviation is worst hit in this. There must be passenger movements, especially international passenger, for us to be able to survive. We've said here on this platform that salaries are becoming difficult for us to pay. So we want to open more than you want to open. We daily living with it. When are we going to open? But this is subject to so many factors. And all of this, all of the sacrifice that aviation is making is in the interest of the public, in the interest of all of us to stay safe. So therefore, government will not abdicate this responsibility of ensuring that we all stay safe. We definitely will open. I hear lots of arguments that a lot of countries have opened. The last I checked, that most of the European countries, if not all, there is ban on us going there anyway. So also in the popular UAE and in America. But definitely we will open. There's also the Subcontinental Committee of West Africa, which we've been discussing since it's an economic union. But we'll open. We'll open very soon when everything seems to be okay and is safe. And like I said, it's a function of a lot of MDAs. It's not only an aviation function. If it is us, we'll open yesterday. Because when we open, it means we make more money. We'll be able to carry on our activities, we pay our salaries and provide the service. So the purpose of us heading this is to, most respectfully I must say, is to be able to judge and find out what is safe for our citizens, for our country. So please bear with the situation. We feel your pain. We understand it as much as you do. We know that some people are cut away from their families and they're cut away from their businesses. But this is an act of God. This is force majeure. So please bear with the situation. We are very responsible people. We will open when it is the right time to open. And I'm sure it will be sooner than later. Tomorrow, like I said, this committee would meet. There's also a meeting at the Ministry of Interior, also where all of the stakeholders will also meet and discuss and analyze and review the protocols. And they will be announced and it will open. This is the same similar way that we went to open the domestic flights, for example. Having opened the domestic flights, we found out that some of the airports, a few of the airports, weren't ready, and we didn't open them. But now, gladly, majority of them, over 80% of the airports are open. So therefore, international airport travel would be open, and it will be soon. Then regarding the question of evacuation, we read in social media and print and electronic media, people saying that in the guise of evacuation, we smuggle people in. It has nothing to do with that. I'm sure Minister of Foreign Affairs will respond to that most efficiently. You cannot deny a citizen from coming back. If he wants to come back and he has a means of coming back, he will come back. But when he comes back, he will now, of course, respect the protocols that are put in place. So please be fair to us. We really honestly want to serve. We are actually serving in the best way that we think we should serve. And we believe that we are doing the right thing. But of course, we would listen. We always listen. And we will tweak where we think that things are not going the way that they should go. So thank you very much indeed.
Mr. Chairman, members of the PTF, distinguished ladies and gentlemen, members of the press, good evening. From the Federal Ministry of Environment, we are still out there with our environmental health officers providing guidance and counseling all the way down to the grassroots. I just want to reiterate and re-emphasize the fight is still raging on, but I will finish the balance in Hausa. Jama'a assalamu alaikum. Daga ma'aikatar muhalli ta ƙasa, muna so ne mu ƙara jaddada muku wato halin da ake ciki a ainihin wannan barkewar cutar corona wanda ta faro a ƙarshen shekarar da ta wuce. A yanzu halin da ake ciki a duniya, mutane na ƙara kamuwa ne. Wato cutar tana ƙara hawa ne kamar farashi. A wannan makon da ya wuce, mutanen da suka kamu a duniya miliyan 16 ya ma haura da kaɗan. Waɗanda suka mutu kuma sama da 600,000, kusan 660 da wani abu. In muka dawo nan gida, bata canza zani ba. A tsakanin awa 24 da suka wuce, waɗanda suka kamu a nan gida mutum 555. Gaba ɗaya wannan ya kawo adadin waɗanda suka kamu a wannan ƙasar ta mutum da aka fara zuwa yanzu sama da 40,000. Sannan waɗanda suka mutu mutum 858. Kun ga kenan tana nan da saurari na aka ba. Ya kuma zama wajibi mu san cewa har yanzu babu wani takamaiman magani wai da za ka sha farar ɗaya a ce ka warke da wannan cutar. Babban magani shine ka bi ƙa'idojin da aka kafa na yanda za ka guji kama cutar. A kullum bayanin da ake yi kenan. Wayannan kuwa su ne maganan sa takunkumin nan yana da matuƙar muhimmanci. Ya kare ka, ya kare wanda kuke tare. Maganan wanke hannu akai-akai. In babu sinadarin da ke kashe ƙwayoyin cuta ka shafa a hannunka. Ka guji taɓa fuskarka musamman idan hannunka na da datti, domin tana shiga ne ta baki, ta ido, ta hanci. Wannan bayani ne wanda za a ta jaddadawa kullum, domin har yanzu akwai waɗanda suke tunanin a kai wannan duk bogi ne. To ba bogi ba ne, domin mutane na mutuwa. In kuma mutum yana jira ne sai ta kama shi zai yadda, to Allah ya kiyaye. Ministan sufuri ya yi magana musamman ta ɓangaren jirgin ƙasa za a buɗe, akwai ƙa'idoji shi ma dole mutane su bi. Na dai sa takunkumin nan, ka tabbatar ka kare lafiyanka da wasu. Kuma ƙa'idojin an ce ba a yadda ka zo da garkuwan fuska kawai ba, kamar irin wannan, auzubillahi, kamar irin wannan. In za ka sa sai ka hada da wannan takunkumin, shine zai baka kariya mai kyau. Kuma bai kamata ka bar hancinka a waje ba, ka tabbatar kafin ka zo shiga jirgi takunkuminka zai iya rufe maka baki da hanci, don kar ka zo a hana ka shiga ka ce an maka ba daidai ba. Ana duba abu ne da ya shafi mutane da yawa, ba mutum ɗaya kwalba. In kuma ka shiga ka cire takunkuminka aka ce kamar kake, akwai 'yan sanda in ka nemi ka yi taurin kai. Ka'idan shi ne ma ana iya tsayar da jirgin a hanka da ƙeyar ka waje, domin sauran al'umman da suke ciki sun fi kai kaɗai kwal. Ba zai yi a bar mutum ɗaya ya zama abin damuwa ga sauran al'umma ba. Saboda haka jama'a muna ƙara kira, musamman ga sallah babba na zuwa, an yi ƙarama a cikin wani hali. Mun samu kanmu ne a halin da muka samu na mu canza yanayin rayuwarmu. Babban sallah za ta zo in Allah ya kai mu juma'an nan mai zuwa. Allah ya sa mai girma sarkin musulmi ya yi bayani na maganan zuwa masallaci ne da duk waɗansu abubuwa. Babban abin da yake gaba shine tukuna lafiyarka, shine ma za ka amfani addinin. To saboda haka mutane su hattara wajen bikin sallah, kada ka je ƙilu ta jawo bau, domin a bikin sallah ƙilu ne in ka duba da in ka je ka jawo makanka corona. Jama'a a yi hattara, a yi hankali, ba da tazara har yanzu yana nan. Musamman ka ce wai za ka je yawon sallah, ka yawo mene? Babu. Dattawa masu shekara 60 zuwa sama a guje su, an yafe maka zuwa gaishe su da wannan sallah. Ka yi zamanka, domin suna ɗaya daga cikin wanda suka fi kasancewa cikin haɗari na kamuwa da ita wannan cuta ta corona. Jama'a abu ƙa'ida, abu tsari, in Allah yadda za mu samu nasara. Assalamu alaikum.
Thank you, Honorable Minister of Environment. Before we take your questions, I will bring to the podium and social development.
Chairman of the PTF, Honorable Ministers, distinguished members of the press, ladies and gentlemen. At the ministry, part of our strategy for discharging our humanitarian and disaster management mandate is the deployment of early warning signals, which help us ensure disaster management, preparedness, and mitigation. It also helps us in building resilience for the future, especially post-COVID. The imperative of this has been underlined by the COVID-19 pandemic, especially in the light of the health, economic, and humanitarian toll it has taken on countries, even developed countries across the globe. I would like to say that as the rainy season intensifies, we believe that the incidents of flooding will not just be disastrous and catastrophic, but they will also impoverish vulnerable population who have been adversely affected by the pandemic and are in dire need of humanitarian interventions. We already have an inkling of where we can go wrong from the Ngwagwalada flooding incident, which was effectively contained by the ministry to the National Emergency Management Agency. We have been drawing up proactive attention of flood-prone states to the annual seasonal rainfall prediction released by the Nigerian Meteorological Agency on 24 January 2020 and the annual flood outlook released by the Nigeria Hydrological Services Agency. 2 weeks ago, the Director General of NEMA was in Oka in the final phase of distribution of fertilizers and relief materials to farmers affected by the 2019 flooding disaster, in line with the President's Emergency Agricultural Intervention Program. We must not let this happen under this COVID-19 period. And that is why we're being very proactive to see that these issues are mitigated. To ensure preparedness based on early warning signals from NIMET and NISA, we are calling on all stakeholders, especially the state governments in the flood-prone areas, to take the following preemptive actions, which is to ensure the preparedness of the State Emergency Management Agency, frontline local government authorities, and other response agencies, to also carry out public enlightenment campaigns targeting vulnerable communities, to undertake mitigation actions and prepare for evacuation to safer ground, to also identify high grounds for possible internally displaced persons camps to shelter and evacuated communities, the silt river channels and canals, remove all refuse, organize a state humanitarian coordination forum meeting to prepare all stakeholders for the mitigation and response, as well as preposition of relief materials to these prompt response areas after incident. You may also recall that the NPower application portal opened to accept applications for intending Batch C beneficiaries on Friday, June 26, 2020, and was supposed to have closed yesterday, Sunday, July 26th. The application process will close now on Sunday, August 9, 2020, by giving a 2 weeks extension. And this extension is to enable as many eligible applicants as possible to apply for the Empower program by providing an equitable and level playing field to all applicants. It also takes into cognizance difficulties some people might have encountered in gaining access to the registration portal, which has seen a record number of over 5 million applications. The Batch C, as has been stated on many occasions, provides an opportunity to train and upskill young Nigerians for employability or entrepreneurship. It is a proactive action as countries around the world gear up for post-COVID-19 economic revival. Sundry and ongoing humanitarian interventions in support of the vulnerable members of our population continue as we progress into phase 2 of the lockdown. Thank you very much.
Thank you, Honorable Minister, Humanitarian Affairs. There are developments in the education sector, and the Minister of State for Education is here. He will be updating us.
Good evening, everyone. Just to update you all on the questions from last week, where I had indicated that stakeholders in the education industry or ecosystem will be rounding up their meetings today. By 2 p.m. today, all the state commissioners and governors have agreed that all schools will open in Nigeria from the 3rd of August. This is to prepare our students for WAEC exams, which will begin on the 17th of August. Now, this varies the timetable we had indicated earlier by as much as 2 weeks. What the agreement entails is that WAEC West Africa and all the countries that are in it have agreed that the exams will proceed, but that the exams that are peculiar to Nigeria will be taken from the 5th of September through to the 14th of September. The exams that are common to all the countries of West Africa will proceed as previously published on the 17th. Nigeria will then proceed to domesticate its own timetable for the exams. This has today been accepted by every state in Nigeria and endorsed by the PTF today at our meeting. It is now up to those who are going for Salah to kindly eat meat carefully so that they will learn as is required. Revision classes begin from today. Good morning.
We now move over to the question session. If you're ready with your questions, can we come around? Okay.
Good evening, sir. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would just like to start with the education. So I'll direct my first question to the Minister of State for Education, please. Just a simple clarification. When you said all schools will resume on the 3rd of August, does that include the primary school? We need clarification because when you say all schools, it's likely going to send some wrong information out. Please, we need that clarification. Then my other question, I actually want to direct this to the national coordinator. Some time ago, we were told on this platform that the Catholic Mission donated some hospitals. During the weekend, I had a conversation with one of the leaders of that mission, and he said none of these hospitals have been taken over, and they have donated them. So what exactly is the update? What is happening? Why are those hospitals still there? My second question is to the Minister of Aviation. You told us that you launched investigation into the alleged breach of protocols by some VIPs at the various airports. What is the update on that? I'm asking this because if sanctions are really not meted out, these kind of behaviors will continue to reoccur. I'm sure you read it last week when some persons in the security services were alleged again to have behaved in a similar manner. So what is the update on the investigation that you are carrying out? And I would like to direct my other question to the WHO country rep. I want to join others in welcoming you. I would like to know, sir, 2 weeks ago we're happy to receive reports about very promising vaccines that are already showing some signs that they will work very well. I'd like to know how many of such vaccines have actually shown such promising results. And what about those drugs that are also undergoing clinical trials? Do we have any drug, as we speak now, that is also showing some positive result for COVID-19? And then the Minister of Transportation. It does appear from your statement that you were pressured to open the railway. You told us about the so many things that passengers must come along with. You didn't tell us anything about what you have put in place, because the PTF has protocols about institutions and organizations, what they should put in place before opening. And some of them include the provision of facilities for hand washing, and even the sanitizer you are saying people should come with. Do you have those things in the railway stations? Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is to the WHO country rep. Welcome to Nigeria, sir. Nigerians would like to know if COVID-19 is a disease or a bacteria. Thank you very much. My next question is to the coordinator. Sir, Nigerian just has recorded 858 deaths and 17,374 persons have recovered. Now, Nigerians would like to know how many victims have required ventilators care from the death and recovery. Thank you very much. My next question is to the DG and CDC. Sir, we now have a total of 60 labs in the country. So this will give us capacity to test for 200,000 per day. I stand to be corrected. Nigerians would like to know if we're on track to achieve the target of 2 million tests, and what is the target date to achieve this objective. And my third question is for the Minister of Transportation. Sir, Nigerians would like to know when will work resume for contractors working on the Lagos-Ibadan Rail project, and also we would like to have an update on Ibadan-Kano Rail project too. Thank you very much. My last question is for the Minister of Health. Sir, Nigeria will be joining the global citizen to celebrate World Viral Hepatitis Day tomorrow. We cannot overemphasize what the impact on COVID-19 on viral hepatitis in the country. Now, sir, majority of viral hepatitis patients in Nigeria cannot access health care because of they have to pay out of their pocket. I would like to know the role of the national health insurance and the state insurance in this regard. Thank you very much.
Good evening, members of the Presidential Task Force on COVID-19, honorable ministers. My name is Yemi Adebayo from AIT. Well, I think I would like to ask some follow-up questions as to what my colleague from Channels TV has asked. The Honorable Minister of State for Education, sir, I want to find out from you, because some of the controversies that the reopening of schools has generated is how to ensure that safety of the students, which is key. I want to find out, in the course of the meeting you've had with all the stakeholders, was the safety precautionary measures we talked about, how are they going to be put in place ahead of the resumption? Then my next question is for the Minister of Transportation, sir. You did say, and just like my colleague actually explained earlier, that you were actually pressured to reopen the railway station. I want to find out from you, are the railway going to be shut after the Eid al-Kabir celebrations or not? Then the NCDC DG, sir, I want to find out from you, sir. About 2 or 3 days ago now, the number of confirmed cases that we have recorded is now reducing as to what we have earlier. What would you attribute this to? Then the national coordinator, I want to find out from you, sir. I recall that yesterday you were on our station and you were trying to explain some of the measures that have been put in place to actually contain the spread of COVID-19. I want to find out from you, sir, as we celebrate Eid al-Kabir celebration, some of these guidelines you have read out, have they been sent to the states as well to ensure compliance? Thank you very much.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ude, I report for Rise News. And my question, actually, I'm starting with the National Coordinator. 11 high-burden local government areas. We've spoken about it time and time again. And whether we like it or not, the infection rate is quite high now. And like the Chairman had spoken earlier, people are still not adhering. The precision lockdown you spoke about for this 11 high-burden local government areas, should we look forward to it happening in the next phase of the easing of the lockdown? And staying with you as well, reimportation of COVID-19 into Nigeria is a major challenge. I had an opportunity to speak to healthcare professionals over the weekend, and they complained, especially for people who are to the country on chartered flights paid by the government of the residents where they were. A lot of them don't get tested before they arrive in Nigeria, and because of that, we're seeing a high number of confirmed cases from this particular group. Yes, I know that we have that protocol of they are supposed to get tested when they arrive here, but they go home pending their results. So what are we doing to avoid this from happening? Are we liaising with the governments of these countries? Because our infection rate in the country is already quite high. We need to forestall more importation of this virus into the country. And my next question actually goes to still you and also to the chairman. The truth is, non-adherence to the non-pharmaceutical is a major issue in Nigeria. So are we thinking of criminalizing it? Because it's over and time again, we hear the chairman appeal, but obviously common sense is not so common, and we need to do something more because we all have to protect ourselves. I am worried because right now the government is paying for treatment, but how long will that be for? If we don't contain it now, we'll be in this for a very long time. Are we considering criminalizing people who break our non-pharmaceutical protocol, especially when it concerns large gathering and non-wearing of the face mask? And finally, to the WHO rep, thank you. Welcome to Nigeria. From all of your analysis and the data that you have at the WHO, when is Africa as a continent expected to peak so we start seeing a decline on the curve as it concerns COVID-19? Thank you.
Good evening, members of the PTF. My name is Juliana Taiwo Balonye of the Sun newspapers. My first question goes to the Minister of Health, and maybe the DG and CDC will respond as well. This is from a concerned citizen who had to, her relative showed the COVID-19 symptoms at the weekend, and she said all the centers she visited did not open. So she wants to know how many hours are they supposed to open in a day, and does it include weekends? Because she could have lost her relative if she had become critical. The Minister of Education, private universities are making case for consideration to reopen because they say they can handle the situation, they can handle their students. What's your response to that? Thank you, sir.
Good evening, Chairman and members of the PTF and my colleagues. My name is Mitaire Ikwen. I report for the NTA. My question is for the Minister of Transportation. I want to ask why, many Nigerians are actually asking, why increase train fares at this time rather than reduce the fares as palliatives during the COVID-19 pandemic? And again, what is the guarantee that increasing the train fares will reduce or prevent ticket racketeering at train stations? Thank you.
Good evening. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. As a follow-up to this question on increasing fares, still Nigerians are looking at Humanitarian Affairs Minister Hajia Saadia for more palliatives. Why increasing? Did you consider economic implications of this increment? SGF, sir. Idan babba ya magana, mutane sun fi saurari mafi yawancin lokuta. Misali kamar a karan farko a satin da ya wuce an ga shugaban kasa Muhammadu Buhari da takunkuman fuska. Yanzu haka wannan abin ya zama abin yayi, musamman irin wanda ya sa mutane yanzu suna sawa. Ina son ka jaddada sako da ka bayar a cikin wani paragraph bayanin da kai na sallah, ka jaddada muhimmancin da kai na kare kai, domin lokaci ne na shigulgula mutane za su ɗauku, za su so su yi ziyara, za su so su yi zumunci. A Hausa ana sallah a Najeriya gaba ɗaya, amma ya fi yawa ne a arewacin Najeriya, kuma mutanen sun fi sauraron, sun fi jin Hausa. Ina so ka jaddada wannan saƙo naka. Minister of Aviation, sir, you sound so emotional when mentioning that the aviation sector was hit. Do you still have the confidence that this sector will bounce back after this, the opening of the international flight? Thank you very much, sir.
Thank you. We have taken all the questions now. We will be taking responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the Honorable Minister of State for Education, the Honorable Minister of Aviation, the WHO representative, and the Honorable Minister of Transportation. But today we will alter the order a bit. We'll begin with the Honorable Minister of Transportation because he has to catch up with another appointment, after which we'll bring the Minister of Health and others that will be announced to the podium to respond to their questions. Honorable Minister of Transportation, please.
The Chairman of the PTF and members of the PTF, my colleagues, distinguished ladies and gentlemen, I thought that the first question has been answered. He said, what is the ministry offering? All we said there is that we will make it mandatory that everybody will comply with the requirements of the PTF. 3 meters to buy a ticket, that's not Ministry of Transport. That's one of the requirements of PTF. 3 meters when seated. We could have said, wear your mask, sit anyhow you like. But because we want to comply with the PTF directives, we said 1 person per seat of three benches. Now, so when you say, what am I bringing? That's what I'm bringing. Exactly. What does he want me to bring? The train and compliance with the law. That I was pressured to open, yes. Because I was imagining how to raise the money to run the rail by this time, when expenditure will be higher than income. And it's difficult for the ministry because it's not budgeted for. However, we had to run. We will not shut down even after COVID, even after the celebration. We will not. We'll continue to run. We will only shut down if we see that you are not complying with the requirements of the PTF committee. If you're not, in fact, if I go on Wednesday and you're not, we'll shut down that same Wednesday. You can go and bring police. That same day we will shut down. For me, life is more important than going to Kaduna and coming back. Ibadan to Kano, we are waiting for the loan. Once the Chinese approve the loan, we'll commence work. But don't forget, it's not going to be easy. We want to employ 10,000 workers. We can't employ 10,000 workers without spreading COVID. So we'll reduce the number of people we will use at a time. And that's the problem we have in Lagos to Ibadan. We are to complete Lagos to Ibadan by May. We finish the tracks. If you go there, you'll see that the tracks have gotten to Ebute Metta, double track. But the problem is, in terms of tracks, from Ebute Metta to Apapa Seaport. We're about laying the track from Apapa Seaport, from Ebute Metta to Apapa Seaport when COVID started, so we stopped. Now, I'd like to give this example all the time. You need 1,000 workers to complete the station at Ebute Metta. Now, only 10 persons go to work every day. So how many days do you need to complete the station that require 1,000 workers? However, work is continuing. This morning we had a debate in the ministry. Should we start running Lagos to Ibadan without completing the stations? Because actually what you need is a track. So people can just walk in and walk straight to the train and go to Lagos to Ibadan. We're having that debate. We should be able to conclude before the end of the month. Why did we increase train fares? It's a choice. We can decide not to increase and then not run until the situation improves, or we run and increase the fare a bit to meet just the running cost, no profit, nothing. Like the last speaker who spoke, he said, my friend and colleague is what are you doing? Giving up palliatives. Please give me some transport so that we can bear the cost and reduce the cost of transportation. Ticket racketeering will stop. It is not because there is no e-ticketing that you have ticket racketeering. The reason why you have ticket racketeering is when you don't have enough coaches and locomotives. Now we have a lot of locomotives. That's why we say before there were only 4 train services. That's about 8 in a day. Now we're offering you 14. So if anybody tells you you have a ticket, don't buy. Because there are enough. We're going every 1 hour. There is enough, you have enough. In fact, we're bringing in a DMU from Lagos in the next 2 weeks. DMU will get to Kaduna in 1 hour 15, 1 hour 20 minutes. Speed train. And you have enough seats. There are 10 coaches. If we're not careful, we'll be running empty. We are carrying 4,000 passengers in a day before COVID. We have not provided for the 4,000 passengers in a day if they will be there. I think that's about the questions I was asked. I don't know if did I leave any? Thank you very much.
Yes. Thank you, Minister of Transportation. We'll take the technical responses first, the Minister of Health, followed by the DG NCDC and the National Coordinator. Honorable Minister of Health.
Thank you. The questions about hepatitis. Yes, it's true. Tomorrow is World Hepatitis Day. And we are going to mark it at the Ministry of Health. There will be a conference, press conference, and I'll be giving a speech. Now, in 2018, Nigeria conducted the National AIDS Indicator and Impact Survey. Nice. And we used that opportunity to also see the prevalence of hepatitis in Nigeria. And at that time, it was determined that hepatitis B is present in 8.1% and hepatitis C in 1.1% of the population. That's the prevalence. Now, for those who do not know, hepatitis is a disease of the liver. It's an inflammation of the liver and caused by, in this case, caused by virus. Just like a virus, like, you know, a virus like any other virus, specific to the liver, and the types of virus, ABC. So Nigeria has been responding to the hepatitis situation with vaccination since 2004, and it's provided by the NPHCDA, National Primary Healthcare Development Agency. And the coverage as of this year was 59%. So what we need to be able to do is to expand the coverage by looking for more resources to get more vaccines and also more opportunities for immunization and reaching those areas that have not been reached, particularly the hard to reach areas. So yes, the NPHCDA is the one, not the NHIS, that is the one conducting that program of vaccination. Now, the other question is about the testing centers. Yes, our plan is to have all hospitals, general hospitals and federal hospitals, as sample collection sites. But we can't guarantee that all of them will be able to do that at night. We are encouraging them to have a holding area, to have the facilities that will enable for bring human resources to be trained, and they'll be given the necessary wherewithal, the personal protective equipment and the sample and the kits and a mechanism for recovery of samples collected. But surely anybody who has any symptoms should endeavor to go for testing by daytime, things slow down by night. But I can assure you that places with high burden and high specification like National Hospital and also the University of Abuja Teaching Hospital in Gwagwalada may be in a position to conduct such tests, to take samples at all times. But that's not something so urgent that you have to wake up at 1 o'clock in the night to go and test, except you have symptoms, you are very sick, in which case you can go to known areas where you can be put in a holding room and until a test can be done. And we are hoping, rather our plan is to make sure that the point of care, the major points of care have a PCR machine, a gene expert machine, so that they can do their own tests once patients who are suspected to have COVID appear. So you don't have to take a swab and then wait for days for your result to come. So we are put that one quite clearly in our plans to have the major treatment centers be equipped with their own point of care diagnostic machine, which is generally the faster operating gene expert machine. But again, I will use the opportunity to urge all citizens, if you test positive and you're over a certain age, let's say 50, or you have comorbidities that you know about, go and register your presence somewhere in any of the treatment centers. And if for any reason you haven't done that and you feel any symptoms, do not wait until the next day. Do not say, okay, you wait until later. Go immediately to a well-known treatment center and register your presence in there so that you don't fall into distress at an odd hour and then you're looking at that time for help when things slow down. Things tend to slow down at night. So that is the advice for all citizens to enable us reduce the case fatality rate even further. Thank you. Yeah, what I told you is that viral hepatitis is already included. You get a birth dose of it. Since 2004, you get a birth dose that's given, and the coverage is 59%. So birth dose means that it's routinely given. Okay, so it's not something that health insurance has to spring up and start delivering. The National Primary Healthcare Development Agency runs that program and gives you birth dose. The coverage right now, according to latest information, is 59%. And the health insurance finances these things, but the primary healthcare is the one that carries out through the primary healthcare development, primary healthcare centers, the routine immunization. It's supposed to go into routine immunization, supposed to be strengthened. We're in the third year of an agreement with Gavi to finance vaccines. It's a $3 billion deal, of which Nigeria is paying 1.97 billion over time. This is the third year of it, and Gavi is bringing 1.07 billion. So that program guarantees this package of vaccines.
So thank you. I'll be very brief because I think the questions we've dealt with severally. On testing, our target actually was to test 2 million by the end of this month. But always remember, the purpose of testing is not necessarily the target itself. The purpose of setting a target is to mobilize action towards that goal. When we set that target, we had many states that were resisting testing. Now, every state in Nigeria is at least coming forward to test, every single state. We have 60 labs across the country. We've activated gene expert sites. We have 60 sites altogether. So yes, we're not yet at our target, but what we have done is mobilize the entire country towards this. And remember, like I said last week, the test in itself is not the end. The test is a window into a spectrum of both clinical care and public health that is now mobilizing itself across the country to improve the response. So yes, we haven't met the target collectively. It's a Nigerian target, it's not an NCDC target. But I think what that target has done is focus our minds on what needs to be done in order to respond to this outbreak. A link to that is the question on the numbers appearing to come down a bit. It's too early to interpret whether we're seeing a plateauing. Yes, the numbers fluctuate between 500 and 700 every day. Sometimes we see a bit more. But remember, even though we report this as one outbreak, there are really several clusters of cases happening. The only state where we have seen a consistent trend is in Lagos. In many other states, we've seen increases and decreases at different points, depending on a series of activities. Ability to test, something definitely happened at in Kano at some point, and we got over that, apparently. So there are continuous investigations going on and efforts to understand the outbreak in the different parts of the country. But remember, even though we report this as a single outbreak, it really is not a single outbreak. These are different drivers of transmission in different parts of the country. So we need to look at it in a slightly more differentiated part. In some places, numbers are still increasing. In others, they are stabilizing. And in some places, we may be at the beginning of a decrease. But the key message is to keep pushing. Thank you.
Thank you. So the first question has to do with the Catholic mission hospitals that were donated. So we are grateful to the Catholic fraternity for donating 146 hospitals for the purpose of COVID-19. We liaised with the NNPC and their partners with regards to taking some of these hospitals up. Of course, they will all require some degree of renovation and equipping. As we all know, not all hospital structures are fit for purpose when it comes to infection control. In this regard, the NNPC and its partners were able to identify 6 hospitals in 6 states, choosing hospitals that had 50 to 100 beds. They are in the process of considering them for renovation and equipping before handing over to the state task force. This is because generally the NNPC group are concentrating on greenfield hospitals, i.e. hospitals that are new, infection-related hospitals. But we may still come back to the Catholic mission when these hospitals have been renovated. But having said this, I think it's worth remembering that we have more than 7,000 isolation beds across the country, but not all states, such as Lagos, for instance, have saturated their bed capacity. Across the country, only about 60% of our isolation beds are occupied. This is because some states do not have a lot of cases and others have too much. Lagos, for instance, have overrun their capacity for isolation a long time ago, and that is why they are concentrating on home-based care. But there are states that are hardly using their isolation facilities. We also have a large number of isolation treatment centers that were set up through the CACOVID arrangement, i.e. the private sector. Just recently, we have the Abuja Dome that has been commissioned and is now operational. So in terms of capacity, I think for a lot of states, we still have capacity. but we'll still continue to accept and work with those charitable organizations that continue to assist the COVID response. In terms of the questions with regards to number of people on ventilators, on average we have between 3 to 5 persons on ventilators throughout the country. So you do the maths, how many cases do you have on average? That will give you the answer. So in essence, we don't have a lot of people on ventilators in the country. We have 265 beds that we can use for ventilation. But we have on average not more than 5. As at last week, I believe we had about 5 patients on ventilators. I'm not going to go into the possible causes or reasons for that. Guidelines to states, Amaka, I think you asked whether we were communicating with the states with regards to some of our guidelines, such as the one that I've just read out. Well, all our guidelines are, as you know, published in newspapers. They are also published online, including our State House website. We also have direct link with the state governments. Some of the guidelines that we write, we actually correspond with them and discuss with them. We have a representative of the Nigeria Governors Forum in the PTF as part of the pillar. He heads one of the pillars we have. So communication with states is not really a major issue. Just like you have access to the guidelines, it's very easy for them. All they need to do is to link up through the Nigeria Governors Forum. But as we've said in the past, what we are providing is a baseline. States can do more. They should not do less, preferably, but they can do more than what we have put forward as a sort of, we provide the foundation, the minimum required to ensure safety for people, for our citizens. Okay, local government areas, yes, we have 11 high burden local government areas that we've identified. We are doing a lot of work in these local governments, especially as it relates to risk communication and community engagement activities. We are also trying to improve testing, particularly in Lagos, where 7 of the 11 local governments are. We are improving case management. We are discussing with the various states in terms of improving access to care, access to oxygen, etc. So the precision lockdowns are only one of various options. The main problem we have with lockdowns in these areas is the geographical nature of the local governments. So for instance, Lagos, if we were to lock up those 7 local governments, we'll have to lock down the entire state. States like Bayelsa as well, Yenagoa, which is a local government that has a high burden. If we lock down Yenagoa, virtually all the roads that go across the state have to go through this local government. So technically it will be very difficult, but as we know, if the interventions that we propose are being implemented and people are cooperating, you don't actually need to lock down people at all. It will still work. So, but that brings us to the issue of non-adherence to non-pharmaceutical interventions. Just this week, over the weekend, we had to take action in some parts of the FCT where there were issues with enforcement, particularly Saturday evening. And we will continue to do this through the law enforcement agencies. You ask, Amaka, if we should be criminalizing non-wearing of face masks. So as you know, for a lot of the state governments, they actually already have acts in place for non-wearing of face masks. But of course, we don't know how many people have been brought to book. Personally, when I come across somebody who is not wearing a face mask in front of me, I would challenge them. Because when you wear a face mask, you're actually protecting more of the person you're meeting or you're with than protecting yourself. So in other words, we should be challenging those that repeatedly flout our non-pharmaceutical interventions and our rules as regards personal safety. And certainly we would it's particularly important at this time as we go into Salah for people going into large mass gatherings without face masks. Really, you're putting at risk everybody. And it's just not right. Behavioral change will come with a change in risk perception, but sometimes you also need a communal involvement. We have to be in this all together. It's all about all of us deciding that this is what is acceptable socially and culturally, and this is what is not acceptable. It's all about cultural change, and it requires all of us to work together and convince those doubters that are still out there that by wearing a face mask, you are actually doing something good to your community and to your people. Finally, importation of cases. So I'm not sure whether you are referring to the diplomatic community here or not, but our current policy states quite clearly that if you are boarding to come to Nigeria, you need a negative PCR result. When you arrive, we will still test you. There's a small cohort that we do not test for specific reasons, but what we have actually been seeing is that even for those that we test, about 10% in Abuja and up to 20% in Lagos, when retested, turn out to be positive. So we don't know whether it's the quality of the test that they have outside the country that is poor, i.e. maybe they have quality assurance issues, or people are just getting fake results and traveling with it. But either way, as we go into the next phase of opening up international airports, we will take a decision as to whether we should be testing pre or testing on arrival. There are about 10 countries that ask for testing on arrival, about 15 countries worldwide currently that request for some sort of certificate, etc., for testing. But the majority, I can assure you that the majority of persons that come into the country, whether or not they have a PCR result, will be tested, and we know their status. The uptake is much better, of course, in Abuja than Lagos, but we are working on Lagos, and I'm very confident over the next few days, by early next week, most of the Lagos issues would have been resolved. Thank you. What is your question? You would want to know how many people on ventilators have died. So I don't have that figure, but I can tell you, even in the best environments, even in the UK, for instance, if you go onto a ventilator, your chances of dying is more than 50%. So it's pretty high. It's very high. You are best not to go on a ventilator if it can be managed. But once you go on a ventilator, in some countries it's more than 60%, even in countries with advanced health systems. So that's my answer. I don't have the data on how many of them. Case management, this is actually Federal Ministry of Health. It isn't a PTF issue. Thank you.
On that note, I will bring the Minister of Health back to the podium.
Your question is how many people are using ventilators? In Nigeria? Well, our statistics so far is that less than 2% of people have required ventilators, less than 2%, yet have used ventilators. Nobody dies from ventilators. The ventilator is supposed to save, but the point is that the use of it is not as much as we had thought. And in other countries, it turns out that they use ventilators a lot. And so we put at the beginning the focus on procuring ventilators. But the experience we have had is that we have only 2% have actually required, and the majority have been okay with oxygen supplementation. So we just use oxygen concentrators more. That's why we are putting more emphasis on procuring the oxygen concentrators, and the ventilators haven't come in as frequently as we thought at the beginning. And it's consistent with the evolving pattern of this COVID and the way it manifests in different places, probably, but science still has to rule out why not so many people require ventilators here in Nigeria. So the use has been very low. And Lagos has reported that they're okay with supplementation, just giving oxygen, that's all. So we are looking at oxygen tent, that you have a room that is loaded with oxygen, and then people can go inside and have the higher oxygen concentration they're looking for. So it's a clinical question for case management. Yes.
Okay, we'll proceed to the next segment of the responses. We'll take in this order. The Honorable Minister of State for Education will come first. Honorable Minister, the WHO country rep will come next. Then we'll take the Honorable Minister of Aviation before we go to the chairman of the PTF. Minister of State Education.
Okay, well, to clarify quickly, let me go through that again. What we said is that the schools that will be reopening are schools that are centers for these exams, and only in respect of the exiting classes. Primary schools and all other classes are excluded from this decision-making process. We arrived at this decision, like I explained, having met with all the stakeholders. Part of what they will update us with on Friday, on 29th, our cutoff date is 29th, which is 3 days' time, in 2 days' time, will be for them to report back as to their state of preparedness on the 29th. The state of preparedness of each of these centers will inform how they open. I'm in discussions with my brother, the Minister of Environment, and we are also awaiting at the Ministry of Education. Wherever we see gaps in their state of preparedness, we will address and help get in there. If it is not possible, then we will not be able to use them. But all the state governors and state commissioners of education and all the other stakeholders, Association of Private School Owners, have all given us their commitment that they will try to resolve this, provide for the teachers. WAEC will also provide for their invigilators and make sure that this conduct is seamless. Before I go into the part about private schools, private universities, let me just take a minute to recap what I've explained in Igbo language for the purpose of the question the sent in from Voice of Nigeria. Ụmụnne na ndị ọma ndị Nigeria, a na-akọwa na ụbọchị ule WAEC a ga-amalite ya na mgbe ọnwa Ọgọst gbara 17. Anyị ga-ebido ilu ule a ruo mgbe ọnwa Septemba ga-agba ụbọchị 14. O were anyị ka anyị ghọta na onye ọbụla ji bido ugbu a kwadowe. Anyị na-akwado ka ụlọ akwụkwọ niile ndị kwesịrị iso n'ule a ka ha bido ihe dịka na ọnwa Ọgọst mgbe ọ gbara ụbọchị 3 mepeju ụlọ akwụkwọ ndị a ga-eji were gawa ihe ndị a. Onye ọbụla kpachara anya ka ha mụọ akwụkwọ ugbu a iji mee ọfụma na ule na-abịa abịa. Ọ ya mere nji ama ọkwa ugbu a. Ụlọ akwụkwọ niile ga-enwe nkwadobe. Anyị na ndị gọvanọ na ndị na-ahụ maka agụmakwụkwọ na steeti ọbụla dị iche iche ekwuola okwu kwekọrịta na ihe ugbu a. Anyị agwakwala na ndị WAEC na lekwa ihe ndị anyị kwekọrịtara. Anyị ga-emekwanụ timetable ke ndị Nigeria ka eme ya just otu ọ ga-esi onye ọbụla ghọta n'ime ya. Ọ ya bụ ihe m kọwara n'asụsụ oyibo na anwụ. I come back to English. Private universities. Yes, I'm in receipt of the letter. We have acknowledged it at the Ministry of Education. I have asked the Executive Secretary at the Nigerian Universities Commission to investigate their claim. When we get a response and a state of how they are at the moment, a comment on that state, we will revert as to our position on that. However, we are aware that many of the private universities and a few of our public universities are able to continue with their online engagements. We are encouraging them to continue to do that. We are looking at all the suggestions they have made. They are very well-taken suggestions, and we will use that in formulating a work plan that does not just only affect them, but affect the rest of the country. We do not want to continuously keep some people behind in order to make things work. But we are also mindful that we are running a country and it must be as inclusive as possible. So in the next few weeks, a few days, we'll be making that adjudication and we'll revert to all private university owners via the appropriate channels. Thank you very much.
Thank you for your questions. The first question was about the promising vaccines. What I can say is that as of 24th of June, WHO has recorded 25 candidate vaccines. I want to emphasize they are candidate vaccines and not promising vaccines. To decide whether they were promising or not, as you know, WHO has a strategic advisory group of experts on vaccines and immunization. After those 25 candidate vaccines will finalize the clinical evaluation underway now, that expert group will be able to review the evidence and advise the WHO Director General whether we could consider any of them as promising so that we could go to next stage. The same applies for drugs, for treatment. As you know, WHO has launched the Solidarity Trial and invited the country to join and evaluate different regimens. And the disease is still new. We are still learning. Many therapeutic regimens are being tested. And at some point, the expert group in WHO will revise evidence and also advise on whether they should be included formally into the treatment guideline for COVID-19. COVID-19 is a disease. It's not a bacteria. It's a disease caused by a virus called coronavirus. That virus is transmitted from infected person through droplet. When a person speaks, coughs, or sneezes. That's why it's very important to consistently wear face mask when in public and observe other non-pharmaceutical interventions. When is Africa expected to peak in infection? The review of trends so far shows that we are still on an ascending trend. The disease is still being transmitted actively. Most of African countries have community transmission firmly established. That's why it's important we continue to observe measures edicted by the government. And I would like to reiterate the message shared or given by Dr. Tedros, our Director General. He says we should treat COVID-19 as anytime we have to decide on what to do, we should treat that decision as a life or death decision, because that's what it is. If I know that going through this pathway, I'm likely to find a lion on my way, then I shouldn't take it. If I want to go to a crowded place, I need to think twice. When I need to go out, I need to go out when it's really necessary. So it's very important that all of us we be aware of that. The disease is still being transmitted actively, and we need to work together in Nigeria, in Africa, to suppress community transmission to be able to control the disease. Thank you.
Thank you very much once again. Well, before I answer the two questions that is posed to me, may I make an announcement that today we lifted the ban on Executive Air Services Limited. They have complied substantially with all of our imposed sanctions. They paid part of the fines and they brought out payment plan. So we've lifted the ban today, so they continue to do their business. As these type of things are not punitive, they are things to make our industry work better and keep all of you safe. Secondly, as the VIP offenders, well, quote unquote, which is undergoing investigation, the report will be on my desk this week, hopefully, and we'll keep you posted. And thank you very much, Hassan, for the question. Whether I'm confident that aviation will bounce back, having been worst hit by COVID-19, the answer is yes. Unfortunately for us in aviation, we've seen our fair share of impacts due one or another thing. Globally, you all remember in the early 70s, the oil crisis. You remember the Iran-Iraq war. You also remember the Gulf War. I remember the Asian crisis. Remember the 9/11. Remember the SARS. Remember the world recession, all this meltdown and so on, which impacted all of it on aviation seriously. But it only left a little dent. As my late uncle would say, may Allah forgive him, Malang Inodusi, he would say that the world is driven by two things: by travel, which is by legs, and by mouth, which is communication. So there will always be need for traveling, and aviation will certainly bounce back, especially if the roadmap that we are diligently pursuing and all of the support that we're getting from government and private sector, it's followed to the letter. We're sure that aviation will come back. And also from history, right from the early 1920s till date, aviation will always double every 15 years. So we hope that it will continue, because that has been the trajectory despite all of these world recession, meltdown, 9/11, Iran-Iraq war, and so on and so forth, including 9/11. So thank you very much.
Finally, we'll invite the chairman of PTF to the podium to wrap it up.
Thank you. I think Dr. Sani has dealt with this question asked by Amaka about the need to criminalize breaches of the non-pharmaceutical measures that have been put in place. I have stated quite often that the operations of the mobile courts are vested within the jurisdiction of the states and the FCT. They are the ones that have those responsibilities. When they sign their quarantine laws, part of what is contained in the laws are what would happen to cases of breaches. We have a challenge of enforcement in this country. If you criminalize the use of face masks in the city of Abuja, I don't know where you will send the people to. There are too many criminals walking around, because the level of non-compliance with the use of face mask or any form of covering is rather, unfortunately, very, very high. Very, very high. And honestly, it's a major cause for anxiety and concern, because that's the easiest way that you can stop this transmission. and is the one that is most resisted for no justifiable reason, but is just resisted. And I think we will continue to drive home the point. We will continue to implore our people, cajole them, do whatever we need to do for the message to resonate with our people, that it is very, very important that in our evaluation of the risk associated with COVID-19, we personalize that evaluation. I'm glad with the comments of with Dr. Olombo, the new country rep, where he re-echoed what the Director General of the World Health Organization has kept emphasizing, that our perception of the risk involved in COVID-19 will be what eventually guide our response. And the simple example he gave is, if you are going to take this path and you know that you are going to be confronted by a lion which might devour you, would you take that path? Obviously, any sensible person will not take that path. It's the same thing. If you have to go out in the public space and the probability of contracting COVID-19 is 90% if you do not wear your mask, it's your perception of that risk that will determine what you will do. Whether you will wear the mask or you just with reckless abandon, what I have always called reckless confidence, which is on the rise and being exhibited on a daily basis by our people. Don't stop on your various platforms, your television station, your radio stations, your newspapers. Don't stop cascading the message that the non-pharmaceutical interventions that have been put in place and that are being promoted by government, wearing of masks in public places, keeping social distancing, sanitizing or washing of your hands, and if you do not have any business going out, stay at home, are the only known procedures now that will help you and guard you against contracting COVID-19. Liberty, you have asked me to speak in Hausa, particularly to speak about the dangers that lie ahead, particularly as we go into the season of the Sallah celebrations. So jama'a, ina so in kawo wannan kuka da babban murya na cewa abinda muka gano da wannan cutar coronavirus a yanzu shine akan cewa an yi rashi na rayuka kusan 858 a Najeriya. Kashi 2 bisa 3 na mutanen da suka rasu dinnan, so dan kayi lissafi ma za ka samu kenan kusan mutane 600. Mutane ne wanda shekarunsu ya bayana cikin shekaru 50 da sama. Muna shiri na wannan bukin sallah, buki na ibada. Kira nake yi da babban murya, in shekarunka sun kai wannan, kana da kuma waɗansu cuta kafin ma coronavirus ta zo, ina kira da babban murya, ba sai ka je sallar idi ba, ba sai ka shiga cikin jama'a ba, kana iya addu'a a sararin gidanka don a kan lissafin da muke da shi yanzu kamar yadda na faɗa kashi 2 bisa 3 na mutanen da suka mutu a Najeriya kusan 600 kenan daga 858 ɗin nan mutane ne waɗanda shekarunsu ya kai 50 da sama kuma mutane ne wanda suke da waɗansu cuta kafin coronavirus ta zo. To da gaskiya kuma roƙon da muke yi bisa wannan lokacin da za a shiga na ibada ɗin nan kamar yadda sarkin musulmi ya faɗa muna daɗa jaddadawa akan cewa ai hattara ba lokaci bane na shawagi ba lokaci bane na bukukuwa lokaci ne wanda ya kamata mutane su yi hankali su yi aiki kuma da kwakwalwarsu na ɗauki matakai wanda ya kamata in ma za ka fita in ma za ka je masallacin ka sa face mask ɗin nan dalilin da ya sa muke rokan mutane su sa corona cutan da ta zo yanzu ɗin nan har yanzu ba maganinta makariyanka shine ka sa face mask ɗin kuma dalilin da ya sa muke rokan mutane su sa shine akan cewa in ka tohamiyo in ka yi tari in kana da cutan wannan ɗan kyallen zai tare ta ba za ka yaɗa shi har mutuminka da yake kusa da kai ko ɗan uwanka ko ɗanka ko iyalinka su kamu da wannan cutan ba dalilin da ya sa muke roka kenan kowa ya sata don ba an rubuta akan agoshin wuni ga mai corona ba ba za ka san wanda yake kamuwa da ita ba akwai waɗanda ake kiran su asymptomatic mutum zai kamu da shi ma har ya samu sauki ya warke bai sha magani ba amma yana yada ta muka ce kuma karan mutane su cunkusu a wannan lokacin akwai abin da ake kiranta social distance a tsaya ka faɗa da ka faɗa kar a cunkusu kuma dole dan ka fita ko yaushe ka fita ka wanke hannunka ko ka nemi sanitizer abin nan da ake sa a buta ana fesawa a hannu ana tsarkake hannu da shi in ba ya zama dole ba kai zaman ka gidanka kar ma ka karbi baki yanzu ina cikin wata na kusan wata 4 ba na karban baki a gidana ba ya zama dole ba in karbi baki ba tunda ina fita ina muhawara da mutane in koma kuma a gida kuma mutane su zo su cika mani gida cunkus coronavirus har yanzu yana da dafinta dafin ba ta ragu ba domin rage muka ce a fita mutane wanda suke da hannu da cunyi su je su nemi abinci corona ba za ta rage mana ba a yau a kasashen duniya gabaki daya mun kai mutane sun kai miliyan 16 wanda sun kamu da wannan cuta fiye da rabin miliyan sun mutu in ba mun ɗauki matakai ba na abubuwan da muke faɗi muna rokan jama'a yi din nan ba za a ci gaba da kamuwa da cutan kuma za a ci gaba ana mutuwa wanda da ya kamata mu ɗauki matake na kare shi ina fata jama'a za su yi hattara za su ji wannan roƙon nan da muke yi ba muna so mu tozata jama'a ba ne muna roƙon jama'a ne don kare rayuwarmu da kare rayuwar iyalanmu da kare rayuwar mutanen ƙasar najeriya na gode muku.
Thank you very much, Chairman PTF. That brings us to the end of today's national briefing. But let me give you quickly a couple of reminders from what we have been saying today. COVID-19 is killing people in their thousands all over the world. Over 16 million cases, over 600,000 deaths. It is hard to put our lives on hold, but we need all our energies to take control of our societies and our future. Please take responsibility, change your behavior, join the fight, and take it seriously. Get tested if you feel the symptoms, and get help. Do not wait. Analysis has shown that people over 50 years of age remain most at risk. So far, they have accounted for 65% of all fatalities in Nigeria. Cumulatively, we have 858. If you have underlying factors and you are within that age bracket, please take compliance very seriously. Stay home, observe the measures. If you feel the symptoms, seek help. Let us protect our senior citizens. As we approach Salah, remember to wear your masks. Remember to stay safe. We have a shared responsibility to stay safe and to protect our loved ones and our communities. And as long as COVID-19 is active, we all remain at risk. It does not discriminate. Until we get a vaccine, we must play safe. This is why we are asking all citizens to weigh our decisions properly. It is a matter of life and death. Finally, do not stigmatize, but do not be afraid of any stigmatization. It is not a death sentence. Join the risk communication effort. Treat COVID-19 as a matter of life and death and avoid it at all costs. I thank you very much. God bless Nigeria. We hope to see you on Thursday, because reaching out to you, telling you the true situation is a 30-hour business in a 24-hour day. So we must always reach you. We are not going on holidays. I thank you very much.